Joining us in the studio, Lauren Bostrom. She is a physician assistant at Tripp Family Medicine in Twin Falls. Bill Colley with you as well on Better Health with Tripp Family Medicine. Remember the slogan, life's too short not to feel good. Actually, quite a few of the things we'll talk about today, I think definitely uh, one of the biggest issues, in fact, one of the first issues she mentioned in an email to me is something it's an annoyance to me when it happens. It's happened on the air a couple of times over the last few decades, and I'll get to that in a moment. I do want to point out as well, if you have a comment or question for Lauren this morning while she's in the studio, the number is 208-736-0300. I had a fascinating email from you that said, what are the most Googled medical issues or topics? And of course, Google can keep a list of all of these.
Yes, I mean, there's only so much privacy on the internet
Right.
these days, right?
people are out there, and they do a lot of self-diagnoses. They can do that now. I mentioned this to Dr. Tripp last week. My dad, 30 years ago, had a medical encyclopedia on the shelves at home, and he would refer to that. Today, you just simply type it into the computer, and all of this literature or these various topics come up. And if you can trust the source, that's the key. Trust the
Yes.
source. You can find out a lot of details, but there's some fascinating results.
They are. I was kind of surprised when Google came out with this list because there's things that I probably wouldn't have thought would be the most Google things. And I would say number one might be the most surprising thing that I found, which was actually what causes hiccups. And this is an interesting topic because in some senses we can figure out what causes them, but for most cases they don't fully understand it. So hiccups can be either just benign, which is for most of us, where it's not a sign of any serious disease, where if hiccups are going longer than 48 hours, then we start to get to thinking about what other reasons could this be causing it. So for most of us, they know that hiccups is this involuntary spasm that we have of the diaphragm, of involuntary muscles that we have, and they believe things like swallowing too much air might cause it, carbonated beverages,
Mm-hmm.
sometimes acid reflux, eating too much food, and sometimes just excitement can do that too for people, which is probably what happened to you when you were on the air. No, I don't know.
Yeah, it's possible. There are times, and and I think it is, and you breathe in heavily and fast. And that happens when you're excited sometimes. And what I've noticed too is when I get them, I'll get them, and they'll go away. Doesn't usually take too long. But if I may not have them for 6 months, but if I get them on a Monday, I may have them 3 times in a week. Then it's almost as if they get more common for a few days, and then they go away for months again after that. That first spasm seems to set off a few more until a few days pass.
Yes, and for all of us, when we get them, we want to know how to get rid of them. So I decided to do a little bit of digging on a resource a lot of us medical professionals that
In other
will
words,
go
don't
back
just
to.
scare people, right? Which was the way it was done years ago.
Scaring is actually on this list. So this is from Up to Date, and these are just a couple of things they mentioned, and some of these I think a lot of us have heard of or tried even. So holding your breath. And then they use a term called the Valsalva maneuver, which you're trying to increase a lot of the pressure in your abdomen. So almost taking a deep breath and holding it and pushing down can sometimes help relieve those. They say ice water. Some of the more odd ones, pressing on your eyeballs. That one I haven't heard, but might be something I try if I have that happen again. And even pulling your knees up to the chest and leaning forward and compressing the chest is another thing they have on here. And putting traction on your tongue too might be another way to go about. So I don't know if hiccups is more embarrassing or sitting there pulling on your tongue, but that's another option.
My dad had a solution that he shared with me when I was a little boy, and he put some water in a glass, and then he took a butter knife, but he put it upside down so the dull end was facing out. The blade was at the bottom of the glass, and he told me, he said, tip this up and have the dull end of the butter knife touch this area right between your eyebrows. He said, there's a nerve there. Now, I don't know where he got this, and he said, then drink the water. And I did that. And they went away, which led me to believe there was something psychosomatic going on.
To help them out. Yeah, it's a pretty interesting thing that can happen. And if you're someone with persistent hiccups, that is something to go see the doctor about. But a short episode of it, don't let Google make you worried.
We got about a minute before the break. We'll take a call and get the caller on the air. Caller, you're up next. You're on Better Health with Tripp Family Medicine on KLIX.
I once read that vinegar taking a tablespoon of vinegar helps, and I don't know most people that can stomach a tablespoon of vinegar. Uh, but pickles. I have my kids eat a pickle when they get hiccups, and it seems to help and have them go away.
I think
Yeah.
it's that bitterness sometimes, whether it be in the vinegar or the pickle juice.
Yeah, and it might kind of change the pH of the stomach too to make it a little bit less carbonated
And
and
then
acidic.
you grimace and smirk though, and maybe you tense your muscles up, and it gets rid of them. We got about 20 seconds before the break. We'll get into a little bit more of this, and also some other things too that get Googled, I'm sure, considerably.
Yes,
Uh,
yep, so there's a whole topic. So if we don't get through all of
Snoring,
them, I'll be here
snoring,
next week.
snoring being another one. Yeah, snoring being another one because I think we've all had a family member that could keep the entire neighborhood awake. So we'll talk a little bit about that in just a short while. It's 8:40. Lauren Bostrom is a physician assistant at Tripp Family Medicine, joining us in studio. Bill Colley as well, handling the telephones on News Radio 1310, KLIX, and newsradio1310.com. We're at 43. Lauren Bostrom in the studio. She is a physician assistant at Tripp Family Medicine in Twin Falls. And we're at 8:40, almost 8:43, and it's 45. Bill Colley, too, on News Radio 1310, KLIX, and newsradio1310.com. You've gotten through all of the recent events at the office, the peel parties and the like, right? It's calmed down a little bit?
A little bit, but we always have another peel party coming up ahead. I don't have the exact date, but I think our next one's in November coming up here.
So people, if you missed this one, this is another opportunity. And if they just go to the website or the Facebook page, right, they'll find more detail?
Yes, we're always advertising that. It's a really good deal that they have because usually you can get for chemical peels about 3 peels for the price of 2. So that's a pretty good deal that you can do and save a lot of money and bring friends, have a good time, and we have some extra goodies too if you come to that party.
And we wanted to point out the office is on Fillmore Street on the north side of Twin Falls. It's across from the post office. And the other part of this, too, is Tripp Family Medicine is a growing office, still looking for new patients.
Yes, we love new patients. We are growing, and we're really excited about it.
Now, we were talking this morning about things that people look up on their own on the internet when it comes to medical issues. There's quite a list. I mean, just the top 10 itself would probably have a few surprises.
Yeah, some surprising ones. Some things that I would have imagined would be on the list aren't on the list. But our second most Googled topic after hiccups is how to stop snoring, which that one doesn't surprise me because we're all looking at ways to make our life a little bit better, and sometimes helping our spouse sleep a little bit better and ourselves too. So that's something that doesn't surprise me too much. So a couple of things they have on here. They talk about changing body positions. So elevating the head of the bed, sleeping on your side can sometimes help alleviate that. My husband was one of these snorers for a little bit, and we even invested in one of those beds that puts the head up a little bit. That did seem to help a little bit. But the other common thing on here too is sinus issues. So if you have a lot of sinus issues, which might have also been part of our problem, getting that addressed. So finding either the right medication. Sometimes people even have enlarged tonsils that's obstructing their airway and causing people to snore, which is actually a common thing in kids. So if you have a kid who is kind of a chronic snorer, take a look back at those tonsils and see if they look a little bit enlarged.
In fact, we should point out that not all snoring is a sign of apnea. For instance, it can be these other things, as you pointed out, sinuses and tonsils and the like. And so these would be things that are easily treatable, and they're not necessarily a huge at the moment health risk like an apnea would be.
Yes, but sleep apnea is definitely something that can be characterized by snoring too. So um, sleep apnea also kind of linked to things like obesity. So losing weight sometimes can help alleviate any pressure too that we have on our lungs. So that can help a little bit. Sometimes it's our medications that we're using. Muscle relaxers, they've found a strong correlation to snoring as well. And um, even if you're a snorer, sometimes even chatting with your dentist, they can help fit a kind of a mouth guard that can help you alleviate snoring by adjusting how your jaw is sitting at night.
And somebody who might on a Saturday night go on a bender could be somebody too who could have a snoring issue, at least that once a week if they're doing that.
Yeah, yep. So sometimes it's that kind of respiratory depression that you can get from medications, alcohol use, and then you can have some people having some snoring episodes on occasion. And then there's the people who just snore when they're sick because they're a little bit congested too.
We've got another caller with us, and it's 846. Caller, you're up next, and you're on Better Health with Tripp Family Medicine on KLIX.
Lauren, the other day I took a 12-hour pain pill in the morning. A little while later, my allergies started. I was then going to take a allergy pill, but didn't because I thought mixing two long-term pills would be bad. Was I right or wrong?
It depends on the pill. So when it comes to depending on the pain medication that you took, so if it's something um, like in the narcotic family, like hydrocodone or Norco, that can cause some respiratory depression, and then adding things like Benadryl might increase that risk a little bit. But doing some non-drowsy medication, whether it be something like Allegra or Claritin, or even something like Flonase, that's not going to cause you any trouble putting those two together.
Want to thank him for the call. There's another point you've got out here on topics, and I don't have issues with kidney stones because I go through a lot of water during the course of the day. But on my mother's side of the family, my uncles all had issues, and two of them I remember being hospitalized at times for these things. And I don't know enough about it to talk intelligently. I do know that they were in some considerable pain. Kidney stones is again one of the most Googled things that people check out.
Yes, and what I can tell you from patients and people I know personally, they'll tell you kidney stones are probably right up there with childbirth. So if you have
Ouch.
one, you're usually looking for ways not to have another. And not that I guess I shouldn't correlate that with kids because you're still looking for other kids, but a lot of people are. But overall, they're really really painful because you're picturing this stone that's going through this really really tiny tube that connects the kidney down to the bladder, and once you see that stone, you might be really sorely disappointed when you see it and you go, "That's what caused me this much pain." But that tube's just not very big, and so
Right,
it hurts while that thing is working its way down out the bladder and out of your system.
right.
So there's different types of stones people can get. There's calcium stones. Uric acid levels can be high, and you can get stones from that. So people who have gout are more likely to get stones. Certain medications might contribute to kidney stones for that reason, and including increasing calcium levels. And not drinking enough water also causes some dehydration and more likely to build some sediment and stone buildup too.
We have another caller. Caller, you're up next. You're on the air with Lauren Bostrom on KLIX. Go ahead.
Good morning.
Morning.
Well, you jumped off of snoring too quick, but I can tell you how to change snoring
I
to
would love to
beautiful
hear it.
music. And you can turn it to beautiful music when you drink too much beer. Just bring home a diamond necklace with you and give it
Oh.
to your wife, and she will not say a word.
All right. I will make sure I pass that on to my husband.
A little bit of bribery, in
Right?
other words, is what he's
No, but-
suggesting. You can keep snoring, but no one will complain. That's an interesting take on that. Talking a little bit about the kidney stones, genetics, because I mentioned uncles
Mhm.
on one side of the family having the issue. They got that from someone, obviously,
Yeah.
in the family.
Yeah. So usually, the most common thing that's kind of genetically passed is probably alterations in the uric acid deposit. And I don't know if they struggled with gout or anything. Sometimes they do, and sometimes they don't.
Mhm.
But that's probably the most common thing we see. So adjusting how you're eating can help reduce the amount of stones. And there's even medications to help lower uric acid levels if you're a chronic stone former too.
Now, when you mentioned the calcium, they were big milk drinkers when they were young, and I always wondered, is it because they maybe should have had a bit more water than the milk sometimes?
Well, overall, it depends on how much water they were drinking. So if they weren't staying hydrated enough, that's going to contribute a little bit to getting those kidney stones as well.
You know, we talked a little bit about snoring earlier, and we referenced apnea. But apnea was just the thing that will leave people a lot of times tired during the day, and they don't even know why. But there also, people are Googling, why am I so tired? Because there are a number of other issues that could leave you tired during the day.
Yes, and I know we touched on this a lot because it is something that we see probably more commonly in the office too. People coming in saying, I'm just really, really tired all of a sudden. And there's a little bit of things to consider, sleep apnea being a common reason. Another one is just anxiety and depression, and sometimes people don't realize how much that's affecting their life. It uses a lot of energy and it affects our sleep and how we function. That's a pretty common thing that we see too. Um, Sometimes it can be as serious as things like heart failure. So if you are someone who goes, I've been really tired, I can't walk as far as I used to without getting short of breath. I have to use a lot more pillows to sleep at night, or have some new development of swelling in my legs. Those are all potentially symptoms of heart failure too.
You mentioned things like thyroid, for instance. I wouldn't have thought about that.
And thyroid is an amazing organ that we have because it does a whole lot of things. So it is huge in our metabolism. So if you have a low functioning thyroid, your metabolism is starting to drop, and that can make you a little bit tired too. Sometimes people will have things like hair and skin changes when it comes to a thyroid disorder, and even changes as far as even our bowel movements can go. Changes in our weight can all be related to our thyroid.
And then one of the other things too, people, and this will be more and more common in the coming months. How long does the flu last?
So the flu, you're expecting probably at least 5 to 7 days of really not feeling well. But the recovery process can sometimes take up to even 2 weeks for people to feel kind of back to their normal selves
A
as
lot of
far as
times,
energy level.
especially when you have something like the flu, you end up with a sinus infection, and so that sinus infection can last a few weeks beyond flu recovery.
Yeah, and so some people get two things at once. And I will tell you that we had our first case of flu here, and we have just gotten our flu shots in. So that is something to go get done sooner than later because it is here.
Now, also, one of the other things that's Googled a lot is what would be normal blood pressure? And I guess we've had some changes in definition.
There are, and it's some providers. We're all kind of on a different debating this topic because most recently the American Heart Association came out with a newer guideline after they previously, just a couple of years ago, had higher the threshold for blood pressure. So they have changed it from 130 over 80 previously, now up to last year was 140 over under 90. And now, most recently, depending on health risk, they say we should really be looking at treating people who have a blood pressure that's above 130 over 90. And these are people who have a history of stroke, many strokes included, diabetes, kidney disease, or if their overall risks, if they have, say, their blood pressure's been a little bit high, they have high cholesterol, they're a smoker, maybe have diabetes, which I also mentioned before. Overall, there's a calculator that can determine your risk of having a heart event in the next 10 years. And if that's high, they say to also be a little bit more aggressive with that blood pressure.
Another thing that I know that I've had doctors change this for me over the years, but how to lower cholesterol. In fact, I've gone from I've had some medicines that were very strong, and then others where doctors said, it was already low. You don't need that much. But there's a big debate going on with a lot of people in the medical community about how to do that.
Yeah. So, how we determine when people start medication for cholesterol used to be just a numbers game. You look at
Hmm.
your cholesterol numbers, and we could decide, yes, you need to be treated or not. And that still is part of our clinical determination to whether we should start you on medication or not. But again, going back to that heart risk calculator, where we can calculate your risk of having a heart event. If that's high, they have said, even if you have a normal cholesterol, that starting a medication called a statin to lower cholesterol can potentially save you from a heart attack or even a stroke. And they're saying that we should be recommending these medications probably more than we did previously.
In fact, I was talking to a fellow who sold pharmaceuticals for Abbott Labs many years ago, and he said that some of these that treat cholesterol are actually very good for reducing that plaque in the brain that could lead to a stroke. And this was some of the side effects they were discovering with the
Yeah.
use of it. So there were multiple benefits.
Yeah, so they found that it can make it less likely to have plaque buildup, and if you do have plaque buildup, be more likely to stabilize it so it doesn't move and cause a clot somewhere, either in the brain or in the heart. And so they did this huge, huge study, and they've said the benefits of a lot of these medications if a person's high risk are really there compared to the risk of using one of these medications. And I know a lot of people, there's been a big scare about these statin medications, and a lot of it related to people hearing about things like some liver problems. The most common thing that we do see is sometimes muscle cramping, which is actually can be a serious complication of that statin, but pretty easy to fix if you do have that to stop your medication right away and it goes away. But that means that your body's actually breaking down its own muscle tissue. But they have done so much research on this that they've said if a patient struggles on one of these statins, to try at least two more before giving up, unless you had something like an anaphylactic reaction to it or a more life-threatening reaction than things like muscle cramping.
Now, we've only got a couple of minutes to go, but you did want to bring up ADHD, which you could probably do a whole show on.
Yes.
But what is ADHD?
So, and this was an interesting one was Googled quite a bit, and I think it's more well known than it was previously. And for a lot of people, they're thinking of kids in school who are having trouble focusing, often getting up and disrupting the classroom, maybe having to sit there and reread the same sentence in their textbook
That's
about
half the
5
people
million
I went to
times.
school with, by the way.
But there's some criterion screening tests that we do to kind of determine if that's truly what you have. And I think probably the more newer thing too is people who carry that ADHD or ADHD into adulthood and have found it disruptive in work. And a lot of people who do have this tend to find jobs that just allow them to modify their lifestyle to accommodate it, but sometimes that's not a possibility. And people are finding that they're having a lot more anxiety at work. Maybe they're getting in trouble with the boss a lot for missing kind of small details on task. And so that's another thing too that we see in the office.
And again, that still needs some more research, doesn't it?
There's always more research needed to be done because they believe it has something to do with catecholamine metabolism in the brain, but it's not fully understood why some people have this and other people don't.
Well, we're coming up on a wrap on the program, but quickly the contact information at the office.
Yes, so we're at 1411 Fillmore Street, and if you want to call and make an appointment, please call us at 208-933-4400. We would love to see you, help you take better care of your health, and if you are sick, we're here for you.
And I want to thank Lauren Bostrom for coming in today, and she will treat anybody that comes through, even if you're a Packers fan. I just want to throw that in there. It's coming up on it.
A sore topic. No.
45, and it's 8:59. We've got news coming up and one more hour of Magic Valley this morning.